Hello, everybody, and thank you for coming to watch this talk on the PEONY study. My name is Sergio Silverio. I work as a research associate in social science of women's health at the Department of Women and Children's Health at King's College London. This talk will be going through one half of the PEONY study, looking at clinicians' views and experiences in both primary and secondary care settings with delivering postnatal care to women with hypertensive disorders of pregnancy. This was a study part of the South London Clark, led by Professor Deborah Bick, who's now at the University of Warwick, and I'm presenting on behalf of my colleagues at King's College London as well, Amanda Bai and Yang-Xing Chang. So a bit of an introduction to hypertensive disorders of pregnancy. They include gestational hypertension, chronic hypertension, preeclampsia, eclampsia, and eclampsia imposed on chronic hypertension, and are one of the leading causes of maternal deaths globally. Whilst the evidence is conflicting, they're thought to affect between 5 and 10% of women. Traditionally, the literature has been looking at how hypertensive disorders of pregnancy are managed, but not at how clinicians feel about managing them. And the aims of this study were very much to explore the clinicians' views and experiences of caring for women with HDPs, to understand what barriers and facilitators there may have been to implementing the NICE recommendations and the NICE guidelines on hypertensive disorders of pregnancy in the postnatal period, and to really investigate where we can revise services to better care for women and meet women's needs in the postnatal period. So you'll see here that there is a table of participants here. This is from the paper which is now published, and later on you'll see a link to the paper should you want to read more. But really, this was designed as a qualitative study using semi-structured interviews, and we interviewed 20 clinicians. These were from both primary and secondary care settings, a maximum variation purposive sample, so we tried to get as many different clinicians as possible, and they were from health services in South London. In total, we had 5 general practitioners, 6 obstetricians, 7 midwives, and 1 clinical research fellow and 1 health visitor. So for those of you who might be unfamiliar with the health visitors in the UK, a nurse or a midwife who's undergone extra training, and they usually visit women at home in the postnatal period. Interviews were analysed using thematic analysis. We used NVivo for data management, but for those of you who don't know thematic analysis, this is a sort of broad brushstroke approach to find out what themes are common and salient across the whole data set. It's quite inductive, and so the themes were generated from within the data rather than being superimposed. And it's an iterative process. And if you read the 2006 Brown and Clark paper, it's got 6 distinct phases to the process. So the results, we had 4 main themes, each with between 2 and 4 sub-themes. I will go through each of the themes in detail, and I'll present data, the most illustrative quotation for each sub-theme in the next couple of slides. So the first theme was variation in knowledge and clinical practice. This was divided into 2 sub-themes: clinicians' lack of assessment and knowledge, and clinical decision-making based on blood pressure range. You'll see here a quotation from a consultant obstetrician who generally thinks that hypertension was undertreated and usually measured poorly. And you'll also see a quotation here from participant 5, who is an obstetric physician, um, who mentions the NICE guidelines and uses and states that blood pressure range is usually the point at which clinical decision making is based upon. The second theme here is communication and education, with again 2 sub-themes: communication and support between services. So this is traditionally where a woman is transferred between secondary to primary care in the postpartum period, and women's engagement with advice and education. So you'll see here from the general practitioner, participant 19, stating, that the messages in the postpartum period might not necessarily be absorbed due to everything that's going on with new baby and mum after birth. By far the biggest theme was provision of care, and the sub-themes here were how do we improve care. The specialist midwives who we interviewed were particularly interested in how we can improve care once women leave hospital and go back into the community setting. But there was also discussion of the limited capacity which will affect care provision, the need for medical care, the need for medical intervention when blood pressure is clearly an issue in postpartum women, and how this might transfer onto subsequent pregnancies. So making sure that hypertension is part of the conversation that women have with their general practitioners in the postpartum period, just as they would talk about contraception and just as they would talk about their own health and their baby's health. It needs to be discussed along with everything else in that postnatal period. And finally, the locus of responsibility for care, which was broadly broken into 2 sub-themes of responsibility placed on the clinician and the responsibility placed on the woman. And as you can see, this makes for some discrepancy between whether this should be healthcare professional-led care in the postpartum period or women-led care or patient-led care in the postnatal period. And you'll see if you visit our poster, which is also at the conference looking at women's views and experiences, that this theme in particular is echoed across that analysis too. So what does this mean in terms of the results when we synthesize all of these themes together? Well, the perceived barriers to the implementation of NICE guidance were actually very varied. The barriers included lack of postnatal care plans, poor continuity of care and care pathways, poor hypertensive medication management, uncertainty about who's responsible for the postnatal care, particularly if it's reaching sort of clinical levels where immediate medical intervention is required. Healthcare professionals in primary care might not feel equipped to deal with that. And there was a sense from a lot of the clinicians that women were potentially being discharged too soon if they had ongoing issues associated with their hypertension related to pregnancy. But most clinicians, which was quite heartening, acknowledge the fact that better planning and communication is needed, better coordination is needed across all healthcare settings to ensure that when women transition out of hospital into the community in the postpartum period, they are well supported and well looked after clinically and emotionally in the postpartum period. So strengths and limitations to this study, well, there are many strengths. This was the first study, to our knowledge, that explored the views and experience of UK clinicians with regards to postnatal care for women who experience hypertensive disorders of pregnancy. We are sort of part of this building evidence base about hypertensive disorders of pregnancy, and we included a lot of different um, healthcare professionals, which is nice to see that we've got a range of perspectives brought into this analysis. Limitations, obviously, this was in the south of England, particularly in South London. It's very possible that the findings here may not extrapolate across into different settings, or certainly into different countries where postnatal care is organised slightly differently. Implications, well, evidence of longer term maternal health consequences is building, as I just said. Clinicians should ensure that NICE guidance is implemented, but actually we need to do a better job at promoting the NICE guidance and actually understanding what the NICE guidelines are for hypertensive disorders of pregnancy. And the continued low priority of postnatal care means that this could have fatal outcomes for women, their infants, and families. And we need to do a better job at improving the transition of women from hospital to home who are also experiencing hypertensive disorders of pregnancy. We need to make sure that the care is equivalent both inside and outside of hospital, and that the care pathways are available to get women the medical care that they need should hypertensive disorders of pregnancy become problematic in the postnatal period. If you'd like to hear more about the PEONY study, as I said, we've got a poster looking at the women's experiences, which you can also find in this conference. That paper is currently being written up, but this paper for the healthcare professionals' views is already written up and is available open access at BMJ Open. And just a final thank you for listening. If you require any more information about PEONY as a study, please contact Professor Deborah Bick.